Hang on one second. Hang on one second. November 2nd, 2020 Health Committee meeting. Okay, Catherine. I'm sorry, Catherine. Susan.
Thank you. I'd like to call the November 2nd, 2020 Health Committee meeting to order. Ms. Morlock, would you please call the roll?
Member Chung,
Present.
Member Metzger,
Yes.
Member Martin,
Present.
Member Wendt,
Present.
Member Gordon,
Present.
Chairman Schaefer.
Present. It says chairman's approval of the minutes. I don't have a date on here, but we have minutes from the October meeting. And I don't have the date. Ms. Morlock, I don't know if you can provide that for us.
I sure can. Hang on one second, please. And I will get that for you.
October 5th.
It was October 5th, 2020.
Okay, thank you. Do I have a motion? Motion by Chung, second by Gordon. Are there any additions or corrections? Okay, hearing none, would you please call the roll?
Member Chung? Member Gordon?
Yes.
Member Wendt?
Yes.
Member Martin?
Yes.
Member Metzger?
Yes.
Chairman Schaefer.
Yes. Do we have any members of the public?
We do not, Chairman Schaefer.
Thank you. Moving on to departmental matters, we have Jessica McKnight, Health Department Administrator. Is she in the room with you? Okay.
Thank you.
Good evening, everybody. So you have my report in front of you, but also another contact tracing update. We are looking ahead to the winter and working on building additional surge capacity. So in the report, I think we were at 31 contact tracers. We're at 34 tracers through the grant at this moment. And we have around 17 internal staff that we've also trained for case investigation and contact tracing. And we're aiming to bring on a total, so an additional staff to equal about 50 tracers by the end of this year. So basing that off of a formula of around 20 per 100,000 population, so puts us around 50. Right now, we're working on putting the infrastructure in place to accommodate that many workers. So space, technology that we'll need for that. Not sure at the moment if we'll need to advertise for more tracers. We're going back through our applications that we have currently. So we have several of those. We're also meeting with ISU next week to continue discussing our partnership there. So we do have some tracers that are on site there. We may be adding additional. And we're also ensuring that our staff for case investigation and contact tracing are available on the weekends and holidays. And just a reminder that contact tracing is just one piece of the puzzle. And so we're really stressing the importance of personal responsibility, asking for cooperation from the public because, you know, it will take all of us really working together to do this. Contact tracing is most useful whenever the pandemic or the illness is new, when it's starting, when you have very small focused groups. So we're, you know, still building the capacity for contact tracing, but we want to again stress that there are several key tools to fighting this virus. So do you have any questions?
Any questions for Ms. McKnight? Mr. Martin?
You got the information today about about people coming from outside our area. How does that impact your office, or does it?
Doesn't really. So, you know, we're working out how to transfer cases if we do have, because we have had some that are out of state, But if they're tested here and they're from out of state or out of county, we have methods in place to make sure that they get to the right facility where they can be case investigation and that process can be finished.
Yeah, I understand there's meetings going on right now trying to figure out if this is going to be a ongoing deal or if it's just a weekend flux. So, all right, thank you.
Any other questions for Ms. McKnight? Member Gordon?
Thank you, Madam Chairman. In looking at your report today, Ms. McKnight, there is reference, it's on page 6 in our packet, but it has to do with the communication plan. I well understand that you have had challenges in terms of prioritizing what needs to be done. I gather this communication plan is going to build on, and I'm hoping that it's going to be building on existing communication efforts. And I think the timing is good, given what has just happened coming from the state level, as far as upping the ante in terms of where we stand on the positivity rate and so on. Glad to see, incidentally, there was a quick item from the Pentagraph that I just caught online that with over 100 new cases over the weekend and today, the positivity rate has declined. I hope that's the beginning of a trend, as I'm sure you do. But could you tell me a little more about what the communication plan is going to involve?
Well, and really, I would ask to be able to bring you more information next month at Health Committee. So I have information that I'll be sharing with the Board of Health this month. So I'll have a plan that will go to them first, and then I'll be able to bring that to next month's Health Committee.
So that'll be at our December meeting on November 30th.
Yes.
Okay, very good. Thank you.
Other questions? Member Chung?
Thank you very much. Thank you, Ms. McKnight, for your report. I guess right now is what's kind of looming on many people's minds is the fact that we have now, our region has kind of tipped to this next sort of level of mitigation. So these restrictions are going to be happening starting Wednesday, is what I've heard. And so for a lot of people, definitely it'll feel like a big step backwards, which I mean, it kind of is, but I guess it isn't as bad as it was back in, let's say in the spring. But, I've read a lot of things where people are saying online that, well, we're just not going to comply. I guess I know the health department isn't really so much in the business of sort of enforcing compliance. So like right now it hasn't been, but I don't know what the plan is if say a number of businesses really refuse to limit the number of patrons and to stop the indoor dining and whatever is on this sort of next tier of mitigation. I guess I was just wondering what the plan is there. My other thing I was going to bring this up last month, but I guess I didn't. I'm not quite sure why, but I know that I've been reading a lot about pandemic fatigue. And this is something that's very real as we head into these sort of cold winter months where people have, seasonal affective disorders and, maybe not being able to see family and this sort of thing. Is the health department thinking of sort of tweaking their message or anything like that? Because, the personal responsibility, definitely I understand. And many people have been doing it. I mean, whenever I go out to a store, I see mostly everybody complying and wearing masks, which, makes me happy. But what do we do about this sort of pandemic fatigue that is a very real thing for many people? We're going on now 8 months of this now. Is the health department planning on sort of changing message or adding on anything else to that? So thank you so much.
Sure. So starting with the mitigation, really our process from the health department is not changing. We'll still be following up on all complaints that we receive from the public and working with the state's attorney's office, documenting and taking appropriate action as needed. So we're still going to follow the same process with that. And then for pandemic fatigue, we've been working with our behavioral health program to get messaging out, but we can definitely use some more of that, I think. So we've been working a lot internally, especially with our staff, and looking at some external communication that we can put out. But yeah, we can definitely do more.
I'd like to follow up on that one, on the behavioral health side of it. When it's fatigue, it can become issues like that. And in fact, we had a meeting today, and they have a group that is working on marketing and stuff like that, and looking at some different things that to be implemented through PATH and whatnot to address maybe some of those issues of like pandemic fatigue. And so when people have questions or concerns and they have someplace to call, but PATH is also another one that you can always direct people to if they hear about that, so, or they're feeling that. Member Gordon.
Thank you, Madam Chairman. I wanted to follow up just on one thing that Member Chung just raised, and it goes back in effect to what I asked earlier. In terms of the content in the communication plan, does the health department plan to address some of these kinds of specifics, especially pandemic fatigue? Because I think we're all suffering from it. No matter how we feel about mitigation efforts, it would be nice if this were, if we could see light at the end of the tunnel. And maybe there is some dim light, but it isn't close enough yet. So I'm hoping that the pandemic plan, the communication plan, excuse me, that the health department is formulating and the Board of Health working with you, I hope that we'll address substantive kinds of concerns along the lines that Member Chung just raised.
Okay, anybody else have any questions for Ms. McKnight? If not, thank you very much. Next up is Suzanne Scott from Adult Detention, and she is not here with us today. So Ms. Rodriguez is going to stand in for her, but she does have an item for action, which is request approval of an agreement between McLean County and Eric Abreu, DDS, to provide dental services at the McLean County Detention Facility. And so we need a motion for that, please. Motion by Metzger, second by Chung. Anything that you want to say about that, Ms. Rodriguez?
Only that we've been very pleased with this doctor's services, and this is an update, or it could be considered a continuation, but in all, staff have reported satisfaction with the services provided, and so we recommend approval of this contract.
Any questions for Ms. Rodriguez? Okay, hearing none. Ms. Morlock, would you please call the roll, and the chairman will vote.
Thank you. Member Chung,
Yes.
Member Gordon,
Yes.
Member Wendt,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. And the general report is from Suzanne is on pages 16 through 19. Are there any questions on that report? Okay, hearing none, move on to Jason Tabb from Juvenile Detention. And he's not here, so I think Mike Donovan's going to be here in his place.
I am here. And we have nothing but the report, and I could be happy to try to answer any questions.
Any questions for Mr. Donovan? Okay, Mike, I'm going to give you a call probably tomorrow, so just wanted to let you know that.
On Wednesday, maybe?
Maybe, okay, that's right. Tomorrow is a holiday.
You might have, you could reach me, but
Okay,
all right.
all Wednesday. Thank you.
Have a great evening.
Okay, you too. Next up is Terry Edens from the Nursing Home Administrator.
And Chairman Schaefer, Ms. Edens is present here in the room, so she'll approach the podium at this time.
Okay, thank you.
Yep.
Good evening. Looks like I have the longest agenda, huh?
You do. You have 4 items for action tonight. The first one is request approval of an agreement for nursing facility services with Vitas Healthcare Corporation of Illinois. Is there a motion? Motion by Gordon, second by Martin. Do you want to explain this one? Or is this one new?
Yes, this will be a new contract with another hospice company, just providing just another hospice contract for our nursing home residents, allowing them to have a choice for their end-of-life services.
Are there any questions? I have one. When you've added, and in the past when we've added hospice companies, is it because the residents are requesting these specific ones, or is it just they have contacted us to try to broaden their scope?
A little of both. I have not personally had anyone at McLean County ask for VITAS, but I have worked with VITAS in the past, and they are just a very good, caring company. And so they did reach out to us, and I feel that, when we offer hospice to our residents, we cannot be biased and say who we think is best. So we let them make the choice, and the more we have, the more choices that they get.
Okay, thank you.
Thank you.
Anybody else have any other questions? If not, Ms. Morlock, would you please call the roll?
Yes. Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes.
Passes.
Next is request approval of services agreement and business associate agreement with First Class Solutions. I have a motion. Motion by Martin. Second by Chung. And I'll let you explain this one.
This is a medical records consultant. This is required by our federal and state government to have someone come in quarterly and just check over our medical records to assure that we're in compliance and covering everything that we need to cover for public health and for the resident themselves. And our current one retired as of October 1st. So we just need a new company. And this company is out of the Chicagoland area. So they're familiar with Illinois laws and regulations.
Thank you. Any questions? Okay, hearing none. Ms. Morlock?
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Okay, that one passes too. Next is request approval of Farnsworth proposal for construction administration of McLean County Nursing Home, at the McLean County Nursing Home. Motion by Gordon, second by Metzger. I'll let you explain this one too.
This is a contractor that we need to oversee the project, the sprinkler and electrical system that we have to have upgraded and replaced per IDPH regulation. So this company would just oversee the whole project to make sure that we're in compliance prior to our next review, so that when they come back, that will pass.
Okay, thank you. Anybody have any questions? Member Metzger?
Have we already got the RFIs done? I see one of the bullet points is that they will be reviewing, assisting and responding to the contractor's RFIs. So we haven't done any RFIs yet?
No, the RFI is completed.
Yeah, the RFI is completed.
So did they help us already do that then?
Yes.
Yes.
They
They did at the beginning, yes.
Okay, so this is, some of the stuff's already been done.
Correct.
Okay, thank you.
Yeah, this is for the sprinklers and the electrical and that we've already approved all of that other stuff over the last few months. So this is just to oversee the project. Any other questions?
I was just confused because it talked about RFIs and I thought we were past that. So thank you.
Okay. If there are no other questions, Ms. Morlock?
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Okay, and the last item is a request approval of position reclassification, and that's on 70 through 75 of the packet. Can I have a motion, please? Motion by Martin, second by Metzger. You want to explain this one too?
This one, I guess they usually do during budgeting, but I wasn't here, so I wasn't able to do that. So I'm doing it, I'm presenting it now. This is for my activity director. Some of the rules and regulations have changed, so that a little bit more is asked of her. She has more continuing education now, and there's just a lot of different things in there that I'm adding to her duties that I feel needed to be reclassified. And I explained them all in your packet. I do have them. If anybody has any specific questions, I can answer them.
Anybody have any questions on this? Okay, Ms. Morlock.
Oh, Metzger. Member Metzger.
Member Metzger has a question.
Metzger, okay.
So this individual has been performing these duties all along. We just have not been compensating her as you see we should have been. Is that what I'm seeing here?
No, some of the regulations have changed of what they're required to do now. And with COVID and more internal things having to be done, we are implementing like a music therapy for our dementia, Alzheimer's patients that she has to go through a special class for. So she'll be certified in that as well. So basically that's the main reason, is to get her up to speed of what we need today with what's going on today. But she has been doing the other things that she was to do before that, yes.
So are we going to change the classification prior to her getting her certification?
Well, I think we have to do that prior to, because I can't expect her to go to school if she doesn't think she's gonna get any more money. I'm just being honest. There's a lot, she's gotta do, I forget how many hours it is, but she has to go through so many hours of training, of course, online. And then she has to do internal where obviously I will be her mentor and her, that's the word I'm looking for. Preceptor.
Preceptor.
Yes. So I too have to take the class, and I'm just gonna do that on my own, just so that I have the knowledge, so that I know, and I've taken part of it, but I haven't went through the whole thing. So I think if she goes through the whole thing, it's very in-depth, and I really think that it will be a very good addition to, it'll be an excellent marketing tool, number one, because we'll be the only one in the Mclean County that has one. So I think that's a plus as well.
And I'm certainly not saying that I disagree with this change, but if she doesn't have the qualifications yet, it seems odd to me that we would increase it. But I guess it's really the position, not the individual. So as long as she is working toward that, I guess that's the direction we go.
Absolutely.
Any other questions?
No.
None? Ms. Morlock?
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes.
Pass.
So got all the action items out of the way. You have your monthly report. Is there anything that you'd like to highlight?
I would just the COVID-19. We are still, knock on wood, have none against our facility. We've had 6 employees, 6 employees test positive. One actually had it and was off, but it didn't count against us because he hadn't been in. Excuse me. And we had a focused, what they call a focused COVID survey. This is actually like the 4th one. They came in right before I started. They came in as a follow-up IDPH, and then they came in again, and they came in again. So this is our 4th one, and we've got 100% all 4 times. So I just want to congratulate our staff. They are just doing a phenomenal job.
That's great. That's really, really good. Are there any questions about her general report? Okay. And I hope that all of you have received the financials after they've been sent to finance so that you've been able to look at the financials that finance gets on that. So look for that again later this week, I'm guessing. Anything else for Ms. Edens? Nope. Oh, wait a minute, Member Metzger, you're catching me at the very end.
I'm sorry. I just wanted to, again, very impressed by the attention to the expenses and revenues. We can't ask for anything more than what you've been doing. So thank you for the efforts, both you, I know that's the attention to detail from your perspective, but your staff I know is also contributing. So thank you.
Absolutely. Thank you so much. I appreciate that. I'll pass it on.
Okay, thank you.
Thank you.
Next is Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer. I don't have any items to present for action this month. You will find our report on recent employment activities on page 81. And as always, I'd be happy to answer any of your questions.
Any questions for Ms. Rodriguez? Okay, moving on. Other business and communication, next meeting date is supposed to be Monday, November 30th, which is our December meeting.
Yes.
So just want to make sure everybody realizes that. Anybody else have any other business or communication? If not, we have bills to pay, which have been reviewed and comply with all of our ordinances, resolutions, and policies. First is Developmental Disabilities Board has a prepaid total of $1,474.75. Motion by Chung, second by Metzger. Any questions? Morlock.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. That passes. The Board of Health has a prepaid total of $409,690.54. Motion by, second by
I'm sorry, who was the first? I missed that.
Martin
Thank you.
and Ms. Morlock.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes, that one passes. The nursing home has a prepaid total of $343,425.80. Motion by Gordon, second by Chung. Ms. Morlock.
Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes, that one passes. And jail and JDC Medical have a prepaid total of $67,583.38. Motion by Metzger, second by Chung. Ms. Morlock.
Member Chung,
Yes.
member Gordon,
Yes,
member Went,
Yes.
member Martin,
Yes.
member Metzger,
Yes.
Chairman Schaefer.
Yes, and that passes. And with that, I believe this meeting